We looked at spinal stenosis. Now let's look at some really cool ways to treat spinal stenosis. This is one of my, I can't say favorites, but this is one that I like to use depending on the patient. It's called the MinuteMan procedure. Now, I'm going to let you think about why we call it the MinuteMan, and how many of you remember what a MinuteMan was. None of you are probably alive who remember a MinuteMan, but regardless. So the MinuteMan procedure is designed, basically all of these procedures, either the Vertiflex, and we have another video we'll talk about the Vertiflex, but all of them are designed to do one thing. Now remember, we talked about spinal stenosis. It's basically arthritis here, the nerve is being squeezed a little bit, the disc is coming back out. So the different things that can cause it, including a disc that's pushing out a little bit, and also the arthritis and the degeneration. This opening is gradually made smaller, and that causes the spinal stenosis. For a full description, we'll refer back to one of our other fun videos. Now, how do we fix this? Well, what we're trying to do is we want to open this space. So if we can just kind of open it up like this, that nerve can breathe. So how do we do that? Well, if we can get something here, now these are called the spinous processes, or the posterior spinous process. If we can get something to lift it, imagine a car jack, jacking it up, and if we can get some space here, we can get an opening. And that's exactly the premise of all of these procedures, whether it's a Vertiflex or the MinuteMan. The MinuteMan procedure, they designed it kind of like, if any of you have been trying to put up a painting or put up something on the wall in drywall, if you have a look here, doesn't that look like one of those drywall screws? I wonder if the creator didn't have that problem and think, hey, this might be good on the spine, as he was missing a painting. Basically, these little wings here, they pop out. And so the approach is from this side. The device is placed through a small cut in the side. It's pushed through. It's wedged between the two bones of the spinous process where we want to raise it. And it's wedged in there with a little screw. You just keep tightening the screw, and it just keeps lifting up. Now, as it lifts up, once you're happy, the prongs prop out, and you tighten both of it together. So the prongs and this, they form a snug, tight fit. Once you have that, you've gained some. Now, people always ask me, they go, wow, how much do we have to lift it? Surprisingly, not a lot. And this is based on a very nice little principle of physics, where if you have a circle, for example, and that circle is, let's say it's 1 inch in diameter. If I was to make it half the size and make it a ½ inch, it's not half the size. The diameter is half, but the area of the circle is actually 4 times less. It's a proportionate decrease. So if you can think of this area as the circle, and it's smaller, if I can get just a little bit of an increase. Now we're talking just millimeters, not inches or centimeters. We're talking about maybe 2, 3, 4, 5 millimeters, and that allows the spine to breathe. So here we have it, the MinuteMan procedure, which is a nice option for spinal stenosis. One caveat there, the spinal stenosis cannot be at the L5-S1. And many of you will go, well, that's obvious. You know why? There's no spinous process here. It's kind of like trying to use a floor jack and it's over a manhole, and there's nothing to grab onto the other end. So here, L5-S1, we can't do it, but the other levels we can do it, and in the lumbar spine, and that can actually relieve the symptoms. Stay tuned for one of our other videos where we talk about the other procedures that we use, including the Vertiflex procedure.